Have you ever noticed shifts in an older loved one's demeanor, perhaps periods of grumpiness or unease, and wondered what might be going on? It is very common for seniors to experience fluctuations in mood, but distinguishing between normal emotional variations and something more concerning like anxiety can be tricky. Understanding the difference is key to providing the right support. Recognizing anxiety from typical senior mood swings often comes down to looking at the duration, intensity, and specific symptoms involved. While mood swings might be temporary reactions to daily events, anxiety tends to be more persistent, pervasive, and often includes a cluster of physical and cognitive symptoms that go beyond just feeling a bit down or irritable. The core difference lies in their underlying nature and impact. Senior mood swings are often reactive, like feeling frustrated after a difficult phone call or happy after a visit from grandchildren, and these feelings usually pass quickly. Anxiety, however, is a state of chronic worry, apprehension, and fear that often lingers, sometimes without a clear cause. It is a sustained activation of the body's fight or flight response, even when there is no immediate threat, leading to heightened physiological symptoms. Anxiety can manifest differently in older adults than in younger individuals, often presenting less as overt panic and more as physical complaints or general irritability. Factors like chronic health conditions, medication side effects, social isolation, and significant life changes, such as retirement or loss of a spouse, can all contribute to the development or exacerbation of anxiety in later life, making it distinct from transient mood shifts. To tell the difference, observe 4 specific patterns. Look for physical signs like restlessness, increased heart rate, shortness of breath, or stomach issues that appear consistently with their unease. Note if worries are disproportionate to the situation, if they struggle to control their thoughts, or if they avoid social situations or activities they once enjoyed. Also, consider the duration, as anxiety typically persists for weeks or months, not just hours or days. Anxiety in seniors is not just about feeling worried. It is a more profound state. For example, generalized anxiety disorder involves excessive worry about everyday events for at least 6 months. Health anxiety, where someone becomes preoccupied with physical symptoms, is also common. These are specific forms of anxiety that extend for beyond simply having a bad day. It is about understanding the underlying patterns and persistent nature of their distress. By closely observing these persistent patterns and symptoms, you can better understand if your loved one is experiencing temporary mood shifts or the deeper, more complex challenges of anxiety. Early recognition allows for timely intervention and support, which can significantly improve their quality of life, fostering a sense of peace and security in their golden years.